Hey, Shannon's friends, fans, and foes. This is Allison, your podcast editor extraordinaire. I want to take a moment and thank you for listening. I am a huge fan of the circus arts and the artist-athlete. We hope you enjoy The Artist-Athlete, Episode 110, Part 1.
This podcast is dedicated to Circus. It's a place for professionals in the industry to share their stories, viewpoints, and information, and a place for outsiders to get a sneak peek into this world. Hey, friends, fans, and foes. I'm Shannon McKenna. I'm the host of the Artist Athlete podcast and the founder of theartistathlete.com. And this is my first episode back from a 3-month break. Oh my God, it has been, this I think is the longest break I've ever taken from creating episodes. I don't know, I'd have to fact check that, but it feels so good to be back huddled in my bathroom, over the mic, looking at the computer and just like vibing with you guys. Obviously over this summer, I was still doing things behind the scenes. I was still giving tons of interviews. We have amazing interviews coming up this season for you guys. And I want to shout out, I always shout out my Patreons and say, you know, this whole podcast is solely funded through people who go to patreon.com/theartistathlete and give small amounts of money monthly to help me create episodes. But they also gave me the opportunity to take a break and to really process what I was making, why I was making it, who I was making it for, which is you guys. And in a world where we're so used to, oh, we have to be productive all the time and we have to make something. And if we don't, we're going to just not have anything. It's so nice as an artist to be able to just take a breath, step back, think about how the things I'm making are valuable to you all, and have a chance to really go deep into why and what I want to make in the future. And that's what I was doing over these last 3 months. And I'm pretty excited about the answers I came up with, and I think you all will be too. So patreon.com/theartistathlete. It's the place to go. Help this podcast become bigger and better every single episode. I love you guys. And because we go in bigger and better, let's just dive right into it. I just want to start talking about today's guest because she is a super smart lady, and the topic that we are addressing today, which is eating disorders and disordered eating, is one that I think is so important to address in the circus community. I want to put a half trigger warning in this episode just to say that if you are a person who is in recovery from an eating disorder, I actually think that this episode is really valuable for you. There's no kind of holding it up on a pillar. There's no, glorifying eating disorders. There's none of that going on. It's just information. We're also not here to shame anybody who is going through this. It is very prevalent. It is something that I've suffered with. It is something that I don't know many people, and statistically speaking, most of us at some point encounter some situation in which we find ourselves in a less than ideal relationship to food. So thinking about how I value this community and want to strengthen it, I think to understand what's going on in our brain heads and how to kind of help ourselves and help others, this episode is going to be really great. So my interviewee today, she's amazing. She's super smart. As I said, her name's Jodie Richardson. She's a clinical psychologist and a member of the Order of Psychologists of Quebec since 2010 and a co-founder of the psychotherapy clinic Connect Montreal Psychology Group. She completed a PhD in clinical psychology at McGill University, and she completed her doctoral studies at the Eating Disorder Program of Douglas Mental Health University Institute. And over her 10 years of clinical practice, she's worked with circus artists, ballet dancers, and Olympic athletes, among others. So this is an eating disorder specialist of the highest degree. She has developed a unique expertise in the treatment of eating disorders and body dissatisfaction among athletes and performers. And in conjunction with the sports dietitian Alexia Dimicar, who was the one who connected me with Jodie, so shout out to Alexia, She recently co-founded Dare to Fuel Performance, a training and consulting organization that educates and supports the sporting and performance arts environments in the prevention, management, and treatment of eating disorders. And I went online, I asked y'all what to ask Jodie. I came up with some questions of my own, and we talked for like an hour and a half. It was a long episode, and so I'm breaking up into two parts. Part one will be what you're just about to listen to, and part two will be next week. In part one, we're going to break down, like, what is an eating disorder? How do we define it? What's the treatment of it look like? What is that process? Just kind of like generally. And then if you tune in next week to part two, we're going to really hone in on what it looks like for an athlete. Because there are some like general things that I think people need to understand or a bit scared of or not quite sure of that have to do with eating disorders. And then I really wanted to like hone in for part two on what makes sense for us athletes, the fears we have around like, if we get treatment, are we going to gain weight because we can't because we're athletes? Or how do you pay attention to what you eat enough to let it fuel your athletic performance, but not enough so that it becomes detrimental? So these are the kind of things we're going to tackle. I've talked far too much already, but I'm just excited to be back. So let's do this, shall we? Yeah, we shall. Here's my interview with Dr. Jodie Richardson. Dr. Jodie Richardson, welcome to the Artist Athlete Podcast.
Thank you for having me. I'm happy to be here.
Yes, we're so happy to have you. So many people are so excited for this interview. Let's start by just, could you introduce yourself and kind of talk about your credentials and what you study, what you're doing in the world?
Yes, I would love to. So
Cool.
I'm a clinical psychologist and I work with eating disorders. Specifically in the past 10 years or so, I've been working with eating disorders in athletes and performing artists. And I have a clinic called Connect Psychology, with a few partners and a beautiful team of psychologists and therapists. And they do a variety of things, treat a variety of issues, but we do have a specialization in eating disorders and specifically with athletes and performing artists.
That's so cool. I think that this is something really important to kind of establish from the beginning, is that there are a lot of psychologists, therapists, people who are mental health professionals out there, and there are specialties within that.
So actually, I started working in the field in my undergraduate degree. So I'm mostly doing work for a nonprofit organization and running like support groups for eating disorders. And
Wow.
then from there, I decided to get into research. So I did research for a year at the main teaching and research clinic, the eating disorders program at the Douglas Institute here for a year. And then I was lucky enough to do my PhD there. At McGill, but also I did my research at the eating disorders program. So I did, spent 7 years there
Wow.
until I graduated. So my research was on eating disorders, but then you do clinical work. So I had to do, a clinical internship in how to treat eating disorders. I also chose to do one in obesity and bariatrics, working with bariatric patients, actually just to get a full scope of whole range of eating disorders. And it wasn't until after my studies, when I graduated, that I actually started to work with athletes and performers specifically with eating disorders.
Okay.
Yeah.
Very cool. Yeah. And what made you interested in this in the first place? Like, it sounds like you kind of knew starting an undergrad that this was going to be your interest or your career.
Well, I mean, as a psychologist, I always joke that like my mom told me I was going to be one since I was like 7. So I don't know if that played a role. But I, had my own personal struggles in high school, as many people do with body image and eating. Actually, many people that I knew around me at that time, my friends struggled as well. I think that's one of the things if you're in a small group, like in high school, if one person sort of struggles with this preoccupation with eating and body image, then it's so that preoccupation kind of actually spreads. And so there were quite a lot of people, I think, going through the same thing. And I was lucky enough to come out of it. Lots of, support, good role models, super important.
Okay.
And then by university, I knew I wanted to do psychology. And as I worked through that, then I started to dabble in, okay, maybe I would like to go into working with eating disorders, actually, on the other side of things.
Fabulous. Well, that's awesome. I'm glad to hear that. Let's get into this. Terminology, let's just start there. What is an eating disorder? I've been kind of mixing up the terms a little bit in my promo and some other Instagram content I've been putting out. Disordered eating versus eating disorders. What help us with some of these terms?
Yeah, absolutely. It's I think they use that term disordered eating actually a lot more when we're talking about athletes and performing artists in the research, like where I see it, just because there can be so much that they say, is this disordered eating or is this eating like an athlete, and there's that question always comes up. And so disordered eating is often used just to kind of clarify or put that line. But I mean, basically it's a continuum from like what we might say is healthy eating or balanced eating to maybe some disordered eating, which could mean that, you've cut out certain foods or you're scared of certain foods, or maybe you're using exercise to sort of compensate for food, or you're doing some of these things that are disordered. And then, if you do that enough, then you'd fall into an eating disorder. If it, happens frequently enough that you might, let's say, restrict your food or exercise as a way to compensate, or maybe lose control over your eating and have what we call a binge eating episode. Sometimes that happens once, twice, a few times, but if that happens frequently enough, then you'd fall into probably an eating disorder category.
Gotcha. So compensating for calories with exercise would be like, oh, I just ate this pint of ice cream. Now I'm going to go for a run so I can run it off or something like that.
Absolutely.
Would that be?
Yeah.
Gotcha.
Yeah. Or, it could be the next day. It doesn't have to be right after. It could be, yesterday I ate too much. Today I have to do a run. This run, it's sort of like exercise is amazing. So what we try to do is really separate it from eating. Like your exercise is this and your eating is this, and the two do not, go together. We don't need to like burn off what you ate, which actually is that common thing that comes up with athletes because they're so used to exercising. It's like, if I don't exercise, am I allowed to eat? Is like, often the question. I go, but I didn't do anything today. I'm like, well, normal people that aren't athletes, they don't. I just sit here at my desk all day. No, I do. Exercise is great, but they exercise a lot more than the regular person, right?
Yeah, actually, that was one of the questions. I guess I'm just going to bounce back and forth. A lot of you guys had really good questions on Instagram, and I have my own questions. But one of the big questions that a lot of people were asking was like, how do I eat when I'm injured or during rest periods? Or, because when we're, I guess, eating and not, I've had this experience of not really having to think about what I ate at all because I'm just like in such a caloric deficit constantly from training.
Right.
That I get a bit freaked out when I'm not, because what is normal eating? What does that look like?
Yeah, that's one of the things that's really hard for athletes because they're used to eating, like you said, you don't have to think about it. You just need to get the calories in because you need to fuel your body. And then It's like, okay, but what do I do if not? And I would say that's one of the times that people are most vulnerable to developing an eating disorder actually is when they're injured, when they have to take rest. So the pandemic was hard on people because they had to stop. So the eating disorder rates really rose in many people, but in athletes and artists, in performing artists for sure.
Interesting.
Because it's like, well, what is normal eating if I'm not training? And I would say in that case, there are a few things we could talk about, like eating regular meals and regular snacks and still eating, you have your 3 meals, you have your 3 snacks, but I would say it might be a good thing for someone to consult like, a sports dietitian who really understands and understands eating disorders in sport and can sort of reassure them that no, it's still normal to eat.
It's okay to eat.
Yeah, you might not need some of the extra fuel that you need but you still need a lot. Like it's not the ratio is not like a 1-to-1. You still need to eat regularly, like a kid would eat, right? You think about a kid, they have their 3 meals, they have their snacks, and regardless of what they're doing.
Sure. So what you mentioned, eating disorders can happen more often when someone is injured or in a rest period. And I love that you touched on the pandemic, because a lot of people also asked, like, did we see a rise in eating disorders during the pandemic? And it sounds like the answer is yes.
The answer is yeah. In general, in high school students, quite a bit, in teenagers, but also specifically in athletes. That's what we noticed, because everything was so uncertain, and also just their normal way to be an athlete was taken away from many of them. And so it was like, okay, well, what should I do to make sure I'm still okay? And it becomes, it's just anxiety around food is normal. So I'd say you just want to get some reassurance and talk to someone about that.
Right. Yeah. And this leads into my next kind of 2 questions. What causes eating disorders, and why do some people get them and some people don't? Because I know people who are athletes and who are, doing their thing. And for some reason, somehow, I actually don't believe it. I think they're in a little denial, but they don't seem to be as preoccupied with eating as others.
Right.
So why?
So when we talk about eating disorders, we talk about like a biopsychosocial model, meaning that there are our biological factors that contribute psychological and social factors. So the biological factors, there is a genetic component. It doesn't mean there's like an eating disorder gene per se, but it means that, there's a heritability there. And so some people will be more susceptible than others to that, maybe based on personality traits, maybe based on there's some stuff around, appetite or hunger, or just sort of like body type. But this is all new research, which is really interesting. But the psychological variables there too might be things that you can think of a bit more like low self-esteem, or perfectionism is a big one. That could make people like a bit more susceptible, maybe some obsessionality. Some people get a bit more hooked on numbers, or and it's hard to get your brain unhooked from that. And then of course social factors, the environment that you're in, the comments that you get, the experiences that you go through, the role models that you have, if they are very concerned about weight and shape themselves, or if they're very concerned about your weight or shape, or if you've been teased around that, then of course that's a big factor. But that question of like, why does because you can be in the same environment, and some people might get it and others don't. I think that comes down to the fact that it's not just environment. There are also these like maybe genetic, but also personality variables. So I use my husband as an example sometimes, because he was a pro athlete, a squash player. And one of the things that makes people susceptible is like when they start a sport young, and then they go through puberty, and then their body type changes, and they're no longer really sort of that ideal body type for their sport, let's say, right? They get taller, and people are generally less tall, or and so they feel like, oh my gosh, I got to do something. So he was like typical of that. He dominated because he was big when he was young, but then being big is not good for, he's like more of a football player than a squash player, but just has no psychological, risk factors, good self-esteem, doesn't care. So I think it's true that there are some people who can kind of get away with, it just doesn't affect them as much. Whereas another person, maybe just a little, environmental piece can actually sort of trigger them.
Yeah. If you think you are a person, say if you know that your mother had a history of eating disorders, or if you know that you're a little more susceptible, are there things you can do to kind of make yourself a little more resilient from the from the get-go, or like to kind of armor yourself? Obviously, like if you're a pro athlete or a performer or something, like you want to keep doing that. You don't want to deny yourself your passion or your calling or whatever you want to call it. So you have to be in those situations. But so what could someone do to kind of boost their resiliency?
Yeah, that takes an enormous self-awareness, first of all. So that would just be like phenomenal. If somebody, to
be like, I know I'm going into this situation, and I know, like you would really have to.
But I do think that happens. Listen, I think it could happen. You're right, because you see someone struggle. It does happen. Maybe like you see your siblings struggled with it, and you're like, oh, I don't want to kind of go through that. Or sometimes you've slipped a little down a slope. There, and
or
like,
I mean, like
pull back.
The National Circus School. It's no secret that they have a very long history of kind of inspiring disordered eating in their students. So if you know that you want to go to a very credible institution or something like that, but you also know you're kind of walking into a hornet's nest of sorts, like what's your beekeeper suit that you could put on?
So you want to know, it's a good question, because what you want is to set limits around how much you focus on that. And then of course have other things you can focus on. So the other things you can focus on would be like, make sure you have good role models, whether it be in your industry or on social media that you can like look to, that you aspire to, who, you feel like you can relate to, and they're not disordered in their eating, and they're not saying you have to have a certain body type. That would be super productive. And also in terms of setting limits, really just not checking too much, on social media. Let's say certain sites will be much more about how your body looks or what your eating has to be, kind of limiting the amount that you focus on this, whether it be by looking in the mirror or weighing yourself, or there are these things that you need to sort of limit, because we're trying to see them. We say that you have, let's say you imagine that you have a pie chart, and your self-evaluation is based on a bunch of things like your, how you are as an athlete, and how you are as a friend, and your traveling, and your piano playing, and, your certain leisure activities. And one of them might be health, and maybe one of them is appearance or overlap. You want to keep that piece of your pie in check, because if it starts to get too large and it starts to eat away at the other spheres, and you find yourself your self-evaluation heavily dependent on your weight, your shape, and controlling it. So you want to kind of keep the things that could get that too big in check, which would be checking things, checking your weight, checking the mirror, checking social media, checking about eating and about appearance.
Gotcha.
That makes sense?
It makes total sense. Yeah. But like you said, it does require a particular amount of self-awareness.
So much self-awareness, for sure.
Man, oh man.
Yeah.
So I guess it leads me to my next question, where if someone draws that circle and starts to look at the parts of the pie and are like, oh man, my slice that's about appearance and food and weight and these things is pretty large. And they seek help. How do you treat an eating disorder?
Okay. So what does that look like? Yeah, I'm gonna go back to like, what is an eating disorder for a second.
Beautiful.
Just to put it in context. So, you talked about disordered eating and eating disorder, and sometimes you hear about diagnoses like bulimia or anorexia or binge eating disorder, and then a sort of other category that encompasses people who don't totally meet threshold for, let's say, those diagnoses, but they all exist in sort of a family. And what we say is there's a sort of trans diagnostic model in treatment, not all treatments. There are some that are more specific, but for example, if we take sort of a gold standard like CBT, and so what we want to help people understand first,
which is cognitive behavioral therapy.
Yes, sorry about that.
Out
That's
there,
right.
no worries. Hey, friends, fans, and foes, Shannon from the future here. Just wanted to slide in because I don't want you guys to get lost in the jargon. So I wanted to define cognitive behavioral therapy, or CBT, which is what Jodie is talking about right now. So CBT is a form of therapy. There's a lot of different forms and approaches to therapy. CBT is used to treat a lot of things: anxiety, depression, marital problems, eating disorders, as we're talking about, and can even be helpful in more serious psychological illnesses. In a lot of studies, it's been found to be as or more effective, sometimes in psychiatric medications, and it's often used in a combined way with a lot of other therapeutic practices. CBT focuses a lot on your present thoughts, your present behaviors. So in something like Freudian psychoanalysis, you'd be a lot more about the unconscious and what your mother said to you when you were 5 and why you wouldn't pick for dodgeball or whatever. But in CBT, you look at your thoughts that might not be productive or helpful, or behavior patterns that aren't productive and helpful, and become aware and then work to change those thoughts and behavior patterns. So that's why it's cognitive, thoughts, behavioral, things you do, and therapy. And that's it. Back to the episode.
Yeah, and it goes across diagnoses. So first, we want to help people understand the eating disorder. So we often will draw them a little chart and help them understand their eating disorder. So we always say that the heart of your eating disorder is what we call this preoccupation, and you might feel like it's an obsession, let's say, with weight and shape, and it's control, like controlling it. And that piece, which is kind of in your thoughts, and your, will lead you to feel like, okay, well, I need to maybe do things in my behaviors. And so that leads to things like dieting and food restriction and exercise. And then from there, we can end up sort of in maybe a more like anorexia, which is an underweight. And that underweight state, what we call like malnutrition syndrome, has a lot of symptoms in it that will like reinforce the preoccupation. So when we're starving, we become more anxious, more obsessive. You'll think about food more. You'll be more irritable. You want to isolate yourself more. And so it just sort of kind of feeds back into the preoccupation, and you sort of get into this isolated cycle with your eating disorder. But oftentimes, and even if you sort of start in more anorexia, what will happen is that the restriction will end up bringing you to binge eating, what we call. So a loss of control over eating, sort of like your body's holding its breath, and then at some point it's like, no, I'm going to come up for air, forget like what you want, we're eating.
Right.
And that scares people a lot. They don't like it. They feel out of control. They feel ashamed. They might start to try to compensate for that in really maladaptive ways. And of course, that feeds back into the preoccupation too, right? Because it's like, oh my goodness, I lost control. Now I need to control things even more. And you sort of get stuck in a cycle. Is that clear? I like to have a whiteboard usually where I like draw it.
Yeah, no, totally. Yeah, I know. I was going to ask like, what does this cycle look like, or how to visualize it? It is super clear. It's interesting, like even as you're describing it, when you hear these diagnoses like anorexia or bulimia nervosa, or these things where they seem so big and dramatic, and actually starvation and binging, these things happen all the time.
All the time.
You know?
That's and no one comes in thinking they have an eating disorder.
Oh.
Everyone feels like, I just need to get back in control, or, it's not that bad, or, this is just normal because I'm an athlete, especially in athletes. And it's like, no, and that's where it's like, if you are feeling preoccupied that much with your shape and your weight, and you're losing control over your eating, or you're isolating yourself. So what we often say is, once it starts to cause significant distress or preoccupation, and or once it starts to really affect your functioning. Like I can, now I feel anxious about going out with my friends, or after I don't eat certain things with my friends, and then I come home and eat them in secret. Or, just it takes a lot of space, then you're stuck in a cycle. And whether we say that's a threshold eating disorder or a subthreshold doesn't matter. What matters is we actually want to catch that as early as possible, because it's hard to treat. It's harder to treat it once it's like anchored in there. It's easier to treat if we can catch it at the beginning. But at that point, it's harder for people to sort of realize and come in. So, that's a preface to what do we do in treatments, but I just want to is it clear kind of what it is and how we explain it to people?
No, that's absolutely fabulous. And I think that is something that I just want to reiterate over and over again for the audience, is that like, you don't have to have like the fuzzy arms, skeletal, like rib cage showing on an IV drip before you get treated for an eating disorder.
Most people with an eating disorder are not underweight, right? Most people have these maladaptive, there's the preoccupation, they have some restriction, but they probably have some loss of control as well. Most people will end up having that loss of control, even if they started by losing some weight. And then they're, well, I'm not underweight, so I don't need an eating disorder, but this is a minority of people with eating disorders.
Yes. Yeah. That's fantastic. Thank you for clarifying that. Yeah. Most people who have an eating disorder are not underweight. Yeah.
And most people don't think they're sick enough to get treatment, which is such a problem, and why they're not seeking treatment. And especially it's not especially with anyone, but with athletes particularly, that's one of the things that I think is really important, is that people in their environment can identify the red flags so that they can be sort of early identification would be really key. They have people around looking at what they're doing and seeing them. And if they know and can sit down and have a talk with them and help them maybe see that they need help, this would be really important, because otherwise what happens is sometimes it gets so big, that preoccupation, that it starts to affect their performance, and they sort of lose all those other parts of themselves, including the athlete part of themselves. And by the time they see me for treatment, I'm not treating someone who's necessarily able to train anymore.
High performing.
Right.
Yeah.
Right.
Sure.
And they
able
could.
To train. Oh,
yeah.
Devastating.
Yeah.
Yeah. Actually, that raises a question that I got a lot on Instagram. I'm kind of bouncing back and forth, but so many people, I loved this question too. So many people asked, how do I support or help a friend seek treatment if they have an eating disorder? And I think what becomes complicated about this is that maybe you can see the symptoms, maybe you can see the signs, but you don't want to be pushy. Like you said, there's a lot of secrecy, and these kind of behaviors can be very shameful. So you don't want to make that person feel like they can't trust you or withdraw. But at the same time, you don't want to be an enabler or someone who's just kind of standing by and watching this person continue to ruin their athletic and just like overall health. Like, do you have advice for people of how to walk that line? Or
For sure. I say the first thing is most people don't want to say anything. It's scary. The person often will be defensive. They might be angry. They might be in denial. They might be receptive, but they could be quite guarded. So it's really normal to not want to intervene as a friend, but even as a teacher or someone in a position of authority, or it's hard. Even they are sort of like, is it my place? I'm not sure. And I would say saying something is always fine, as long as it's really done without judgment or shame. So, what we say is, listen, you want to express concern and you want to name sort of tangible observations you've made. So I've noticed that you've been more tired of training, and you haven't been eating lunch with your teammates or with with us at training. And you've, complained that you had some digestion issues coming up. And, I noticed that you seem kind of preoccupied with what you're eating. So I'm concerned. And I'm concerned that maybe you're going through something, maybe that this is something that you should talk about with someone. So naming really sort of the tangible things you've noticed, and then expressing concern. And the person might say, oh, there's no problem, and that's fine. And so you just sort of leave it and say, well, okay, but I just want you to know that I am concerned and I've noticed this and that I'm here. If you want to discuss how to go about getting help with that. And often if it's like a coach or physiotherapist, for example, will say, then you want to say, okay, well, I'll come back to this in a week with you, for example.
Oh, interesting. Yeah, I love that.
I'm going to come back on it. If it's a friend, it might be you can still do that, but I understand that the role is a bit different as a friend. So you may still just come back to in a week without telling them you will. But, but I also understand that it's hard for people. It's a hard thing to broach with people. And I think some people too, let's say they're a coach or a teacher, they feel like maybe they have their own issues. And so who am I to say something to someone else if I'm not perfect in my own body image and eating? And I would say, like, there's so much problem out there that, like, we're not waiting for perfect people to call this out or to say something. You don't have to be perfect to be a good role model for people. You can be a good role model as long as you just know that what's important is kind of what you say and what you do in front of people. And it's okay if you have your own struggles, and hopefully you're dealing with them yourself. But
yes,
yeah, I think a lot of people feel like, I'm a bit of a fraud in this, which is like, nowadays it's hard not to have such preoccupations. So I wouldn't feel bad about that.
Oh my gosh. I love what you say though, because what a lot of people asked who are coaches or in kind of more leadership roles. Yeah. How do I support people when it's so clear that I can see it? And obviously it's different for each person, but I love that it's not just one conversation in those times, and I'm thinking about my students who have been like had shoulder things or little tweaks on their elbow, where it's not just I'll be like, oh, is this okay right now? But I'm constantly checking in each week. How's your elbow feeling? How's your elbow feeling? And to set that expectation with food or following up on those things too. So it's not just that one conversation.
Right. I care about you. I see you. Yes. I'm not judging you. I'm here, but also you're not, you can't force anyone to go get help.
If you don't know what treatment looks like, or you've never been to therapy before, what can people expect from that experience? Because I think maybe it's a bit intimidating, or there's an unknown component to like, what is this person going to do to me?
Right, right. We're not going to do anything to you, but I'll tell you a bit about treatment. I mean, I'd say, listen, if we talk, I'll talk a bit about treatment, but it is, sure, it's a bit scary to think about doing your work for treatment. I think, when you go in at first, of course, you're really just going to be talking about what the issue is. And the first few sessions will be, making sure that the therapist or the psychologist gets to know you and that you feel comfortable with them. So I wouldn't worry that you're going to be forced into something right away. You can always make that choice. And I always say to people, listen, you're going to decide after 2 sessions whether you like me or not, and whether you want to work with me, and that's totally fair, and you should do that. So, after 2 sessions, I'll be like, okay, what did you decide? And often we'll decide to work together, and then we'll say, okay, let's make some goals. Once we have done that, I'll do some psychoed and really explain the eating disorder to them. One of the ways that helps people understand it is to compare it to an anxiety disorder and say, so everybody knows what a phobia is, like a phobia of a dog. So we'll say, yes, if you're scared of dogs, what would the treatment be? Everyone pretty much knows. They say, well, I guess you make me like go up to dogs. And I'm like, well, I wouldn't throw you in a room with a Doberman right away. But yeah, we look at pictures of dogs.
There would be no flooding experience now.
Yeah, that's totally a psychology word. Exactly. We don't want to flood you, but yeah,
I made this little therapy joke, but I feel like I should also define flooding. Flooding is a therapeutic technique in which the person who has a phobia or a fear is overwhelmed by the thing that is making them incredibly anxious. So if you were very scared of dogs, you would be pushed into a room with a whole bunch of adorable golden retriever puppies.
We're going to look at food right now is the thing that you're scared will make you fat or make you gain weight. Your anxiety is disproportional for what food will really do. And so we're going to walk through that slowly and systematically through treatment. But another way to understand it is a little bit more like an obsessive compulsive disorder. So you have this phobia, but you can't stop eating totally. So it's not like dogs where you can just like totally avoid them if you wanted to. So
Yes.
you sort of, it's more like germs a little bit. So you have to develop kind of what we call like compulsions, which means that you get really anxious and then you have to try to do something to bring down your anxiety. So it's a little bit like washing your hands, like obsessively. And so we're going to also decrease the amount that you wash your hands. In this case, that could be the amount that you exercise or other things you do to compensate. And so we're going to bring that down so that you could see that you're safe, that, you know, you think you need to do X amount and really you only need to, you know, really you're safe if you don't do it. Like you can let go of that control and you're not going to, you know, get all those germs or get fat, because the fear is like, oh my gosh, it's going to go out of control. And so we really work on decreasing those behaviors as well. Does that make sense?
I have a lot of questions
Yeah.
following up to that.
Do it.
Like,
Go.
okay. So the first big question, I think, and the fear, which is like such a cyclical, self-fulfilling prophecy, is the fear around getting treatment is that if you get treatment, you won't, the person will make you eat or make you do things that will kind of, what's the word? Sabotage your athletic performance, or you will get fat, whatever that means. And one of my other questions was like, what is fat? Or like,
right.
Do you work to define that with your patients? Or like unhealthy, like how do you kind of combat that suspicion or that distrust?
One of the things that we'll do is, so we could just go over all of the like kind of beliefs that they have. So like they really think they're going to gain weight super quickly, and they really think that somehow if once they get to a certain weight, that then they're going to have to like control it. Whereas, you know, there is a place that you can find where your body is happy. And whether you're an athlete or not an athlete, you can't really get away from that. Like you think you can, you might want to, but you can't really get away from the fact that your body wants to sort of sit somewhere and it's most comfortable there. And that's where you don't have to be preoccupied. You sort of eat what you want. It'll take some time to get there, and you will be super scared the whole time that it's going to go way past as it's something you're comfortable with. And so we're going to have to take it one day at a time. And you're going to have to learn, because really you're trying to learn to trust your body. And even if you're an athlete, the idea is not, we're going to control your weight so that it's exactly this. The idea is, we're going to find your best place where, you can perform at your best. And so often there's a sports dietitian involved. I have several that I work with, right? And so I'll sometimes, often give them a lot of the eating part, and I'll deal with all the anxiety that comes up of what they have to do, So we'll touch base every week, and I'll say, what was your goal this week? What were you guys working on? And then
Nice.
I'll deal with, how are you feeling about that? And what's coming up for you? And what are the there's a lot of irrational thoughts which don't feel irrational, of course. And how's that feel in your body? But ultimately, people do want to get back to a place where they can trust themselves. And they don't have to be so preoccupied with thinking about this all the time. It's very tiring. And
there are so many more interesting things to think about.
So
for sure.
many more, right?
Than your macros for sure.
And you want to be able to eat intuitively, which of course takes a long time to get there. It takes a while to get there. So we go through we're just going to eat more systematically, and we're going to get you back to a safe place. And then we're going to say, you could totally trust yourself. And let's try to move to that place where you trust yourself and you're making your choices and you're in charge. So instead of trying to get control from an anxious place, you're going to be in charge from a values or confidence place. And we're going to work towards that together. And we're going to do that every step. And so sometimes actually what we do often is that if they're very scared of the scale or of the number on the scale, or if they're checking it too much, or if they're avoiding it, then we will weigh in session together, and I will ask them not to weigh outside of session. And then it's sort of like an exposure that we do in session where I really walk through how are you feeling before, and how do you feel during, and how do you feel after, and what's coming up for you in your mind, and what's coming up for you in your heart, and do, if they cry, and whatever's happening, and just go like, it's okay. It's okay. We can get through this, because you want to hold on to that control, but if essentially you have to kind of just let it go little at a time and see that you're okay. Find how you're going to be okay in it without the eating disorder.
Right. Well, yeah. And I just have to think it's so tricky because there's still an element of like, this is all a process. You're in some sense like controlling when they can weigh themselves. So, like
they'll decide, of course, we're
Sure.
just going to decide together, but I might suggest, like that.
Actually, that's a fabulous point, is like, you're not forcing them to do anything.
Never.
You're not. Yeah. There's a huge amount of consent that happens in, good therapy. That I think that people don't really realize how much agency and ownership they can have over their treatment.
Absolutely. So I'll work through your thought process with you and your emotions with you, and then you'll come to a decision, and whatever decision you come to is yours. Like, and you could stop at any time, and you can say, okay, no, I'm sitting here. I'm not ready to move forward. There's no, and I think it's really just that sometimes you need somebody there with you to do this. Really, it's very, very hard work to get out of it. That's why we really want to identify it earlier, because it's a bit easier, honestly, if you're just a few months into it. But it's really hard to work through it, and it takes so much courage to do that. And so it's really not about forcing you to get better. It's about just supporting you, empowering you, educating you. That's what it is.
So very cool. Oh, hey there. I just wanted to interrupt this interview real quick to just say one real quick little thing about myself, which is that I am not only the host of the Artist Athlete podcast. No. She is a businesswoman, and I run a whole company dedicated to the education and inspiration of circus artists. That goes from people who are just doing it, weekend warriors, as a hobbyist, recreationally, or if you're a professional, you've put in the hours and you need more resources, go to theartistathlete.com. There are a ton of recorded workshops, online manuals and ebooks, everything you could possibly need from me and from some guests on this show about everything from nutrition to training your shoulders to really specific aerial moves that you need to master. Again, theartistathlete.com. And just because you went there from listening to this podcast, use code PODCAST and get 15% off your entire purchase. That's right. Theartistathlete.com. Use code PODCAST at checkout for 15% off your entire purchase. And have a great day. Back to the episode. You mentioned earlier having a team of sports dietitians, and this was something Tara Gallimore, who I don't remember the episode number anymore, but you guys, I'll put it in the show notes. She was a dietitian at the National Circus School and is a big proponent of intuitive eating and an anti-diet dietitian, which I think is super cool. But talking to her, it kind of surprised me how little crossover in the training and in the academic kind of setting there is between psychologists who treat eating disorders and dietitians who know kind of the chemistry and the understanding of nutrition and everything that goes into food. So I guess, could you just talk a little bit about how you marry the two, or how in your clinical practice you can have that happen? Because I think a lot of people seek out a therapist but never get the kind of dietitian aspect, or they seek out a sports nutritionist or a dietitian, which are different things, and they miss the psychological aspect. So how do those two work together?
Absolutely. Yeah, I mean, so even if we go back just a little more, not every psychologist is trained in eating disorders and eating disorders, and neither is every dietitian or every sports dietitian, right? Trained in eating disorders. And actually eating disorders are kind of scary for some professionals who don't know, because they're there's a certain responsibility that they feel. And if they're not trained, they can feel a little bit apprehensive, which is totally understandable, which is why Alexia and I who's the sports dietitian I work with the most, educate and train individuals on this exactly. And then even more so, it's very hard to find someone who specializes in athletes with eating disorders. So one of the things that we're doing is really training first the sports dietitians in understanding eating disorders, and then hopefully they can work with the psychologist. So it's best to marry the two. So most eating disorders programs, you'll find that they have both, of course, as well as other professionals, dietitian and the psychologist, and how. But in private practice, yeah, you're right. Someone could just want to see the dietitian or just see the psychologist, or maybe they don't marry the two together. I find that, listen, I can talk about eating with someone who's not an athlete. It's a little bit less, sometimes it's less of a need. It's still really helpful to have the dietitian, but I can say, okay, you're going to eat 3 meals. It doesn't really matter so much what you're eating, but as an athlete, there is a certain component of, well, let's make sure you're fueling your body properly for everything you're doing. So then I always want a sports dietitian involved when I'm working with an athlete, because I don't know what they should be eating.
There is an aspect of optimization that's super interesting, actually, and really cool when you don't attach all the kind of obsessive or anxiety-ridden components, and you just understand food as fuel. Can be really, really actually empowering and really neat to understand the science behind.
I like that you separated that, because often I'll say that's super cool if it's not married with anxiety and obsession. If it's like values and you're doing it out of love for your body, and you're doing it out of care, and you're nurturing yourself, and it's for performance, and it really feels good. And then there's the anxiety that sometimes becomes the problem with that. But yes, I always have a dietitian to work with me. And so what will happen is, for example, let's say we start with eating regularly, which is what we do. Then she'll set the goals on how they're going to, let's say, work that, increase portions of it in need, start with this snack in the afternoon, and then I'll help deal with the anxiety component. It really leaves me more open to understand. Also, eating disorders are sort of like an iceberg, where the eating part is like the tip of the iceberg, and there's sometimes stuff underneath. And so oftentimes we have to address the tip of the iceberg, but often if there's a dietitian involved, I can more quickly go underneath and be like, okay, well, let's talk about your confidence and how that's affecting you with your teammates or with your at school, and let's talk about this perfectionism and these interpersonal issues that you're having. So I get to, that's more the psychologist work, but of course, so it's always optimal to have that, and then also a doctor involved, of course, to monitor how you're doing in terms of their health, because there could be issues. So the three are really important: the dietitian, the psychologist, and the doctor.
Wow. It's so crazy to think about. I mean, like, for someone who's minimalizing their disordered eating patterns, to then be like, I have a team of 3 specialists who are like,
usually you start with one, but hopefully that one will say, hey, let's, like, you don't want to be alone in this. Like, let's, it takes a little while. So sometimes the dietitian will work with someone for quite a few months before they're ready to meet me.
Okay.
But they'll get stuck somewhere. Yeah. And then they're like, wow, this piece is a psychological barrier that we now can't get past. So I think you could do a lot of good work just with the dietitian, and awesome. Maybe that's enough, and maybe it's not. And then at some point you come see me, and then sometimes we work together, but then I might take over a piece, and the doctor, depending on the health of the client, is involved, more or less. If they stabilize, then the doctor really only needs to meet them less often. So it doesn't have to be everyone all at once. It's really a team that we just try to really help support you through the whole process, because you're the one actually in charge of the process.
Very cool. Yeah. I guess it leads into a question of access. I mean, I love that you say, like, it doesn't have to be all 3 at once, and you're like in this like integrative health, recovery program. Like, it can just be like, I'm going to the sports dietitian to, understand how to optimize. And then there's a psychological component. So maybe Oh no, I just lost my question. No,
It was about access. It was about access.
Yes. Oh my God. Thank you. Yes, access. A lot of people asked, and I know this varies from country to country, state to state, province to province, even, like you're in Canada. I come from the US, and getting treatment, especially for someone who's, a professional athlete or a circus artist, especially where the funds are not always there, how do you gain access, or what would you say to those people who may not be able to afford, or affordability or accessibility is an issue?
Right. Those are two things that actually make it hard, affordability and accessibility. Unfortunately, and I wish I had better answers to that question, but I will try my best. Accessibility, I mean, I guess you're right. It depends where you are, but it is hard to find someone. And I think we have to figure out more socially how to change that. But if you're someone like a university student or an athlete, I would say that the first place to look would be the organization that you're in, because you can often find a name, a referral, an in. Sometimes it's even subsidized to some degree. So at universities, they'll have access to psychologists. Now you might have to wait, or doctors. And if you're like many of the athletes I'm working with, some of them, of course, have to pay for it themselves, but some of them are subsidized for some of the sessions. And they found it through, let's say, the sports dietitian or the physiotherapist, even like that they talked with and became friends with, and then, had a connection with someone in the industry. So I'd say if you have people already that are in the healthcare industry that you're working with, which you do more as athletes than someone in the general population, I would kind of start there to find leads, because ideally you want someone who understands eating disorders and, and sports, which is hard to find. So, maybe just understanding eating disorders is enough, but just starting where you have maybe a connection and going through that. You can always look, of course, at the order of psychologists in your province and see who specializes in eating disorders, but, it may be hard to figure out who does both. And like we said, it can start with, maybe you have a mental prep that you're talking to. Talk to her. One of the things we're doing is she's not going to treat. I'm not saying they're going to do treatment, but I'm saying there's a starting point where some people you want to break the isolation. So I'd say first thing is break the isolation and talk to a health professional who can guide you to find help. And maybe that's the dietitian, maybe it's the physio, maybe it's the mental prep, and each of them might just be able to give you a referral, but the dietitian might be able to do some good work with you. And sometimes you have access to that more easily. In terms of affordability, I mean, there are issues with this if you're not covered by insurance, right? It's a problem, and there are big waits. At least here, there are waits for the system, but there are programs. You can put your name on the list for certain programs, like the hospital programs. Some of them are less long than others, and the local. Usually, there's some local here. It's the CSSO, so you can see someone, a psychologist, but they may or may not be specialized. So I'd say you get your name on some waiting lists, but there are other nonprofit organizations sometimes, right, that do support groups and that can guide you to resources. So in Quebec, we have like ANEB Quebec, where they'll offer support groups and things that you can get involved in as you wait to find a person that's appropriate to see you. Yes. There are books you can read. You can go online and find, sites like Recovery Warriors or other who sort of can inspire you. But yeah, I do wish it was easier to find help. Yeah. I do.
No, and it leads me into another question a couple of people asked, which is, can you kind of recover yourself, or can you dig yourself out of an eating disorder?
Oh, that's a good question. It's possible. I don't know that it's hard work to get out. I'd say it kind of depends how far in you feel you are. But you can always start. There are workbooks you can get online for, how to work through binge eating or work through body image issues.
Yeah.
Good work works for that. And then if you see that you're struggling, well, then you might want to ask for some help. But the key, I would say, is like eating disorders feed on isolation. So you want to have someone that you can just open up to. It doesn't have to be a lot of people. It really just has to be a trusted person or another, where you're not isolated totally in this, because that's where your mind sort of can feed on all of this stuff. And so you want to not be so alone in it.
Eating disorders feed on isolation. Yeah. Yeah. And kind of what you said before about like, who are you following on social media or all of that kind of, all those things. I mean, even if you can't be around other people because you're in lockdown somewhere or something, like social media is a social component of your life. And what are the messages you're getting there? And you can control that.
Yeah. And so I
sort of imagine that would be one really good way.
Always ask people, especially the athletes, okay, who's the role model that we can look at that's doing something really cool and really healthy and really proactive in this domain, and like that you respect. And so, when I'm looking at some of the posts that you have on this, even, it's really inspiring for people, right? To call out like, oh, someone, said, oh, you have bigger legs, or to to put that out there and say, hey, you know what, you can use this as your strength. Because actually that's one of the main things, is that if you want to get your focus off one thing, which is like, oh my gosh, they're judging me, or oh my gosh, I'm not tiny enough. It's like, can we focus on something? Can we shift that focus to something? And sometimes that is something like strength. Like, okay, I'm strong and these legs really help me. Or it's just another body part that you really perform with, like your eyes, and you're like, that, you focus sort of somewhere else. Or it's freedom, or it's something that, you focus on. And so it gives you another focus, like something to aspire to. So yeah, role models are amazing, and finding something else to focus on that's like positive in terms of values. It's not fear-based.
And yeah, that seems like a good place to take a break and end part 1. Part 2 will be next week with Jodie. So go ahead and hit subscribe to the Artist Athlete Podcast. We have new episodes every single week with interviewees in the circus community. And next week, we're going to be back with Jodie talking about specifically the difference between treating somebody in the general population and treating an athlete for disordered eating. I wanted to wrap up just a few points that I really wanted to hone in on in this episode. The first, and I think largest, is that what Jodie said when she said, nobody comes into the clinic thinking they have an eating disorder. I mean, obviously they must have some idea that they do because they're at her clinic, but nobody, or rarely do people realize how bad it's gotten, because there's a kind of idea that we all have that people with eating disorders are very, very thin and they're very sickly. And actually, a lot of people who suffer from disordered eating or body dissatisfaction are normal weighted people who just have incredibly irregular and harmful patterns in the way they eat. And these harmful patterns, these detrimental thoughts, these actions that are hurting you are done in secret. Eating disorders, Jodie says, thrive on secrecy. They thrive on hiding them. They thrive on the shame that people feel about their bodies, about their food, about themselves on some level. And that's why you want the support of a psychologist to unpack. And that's what I want to normalize, is that these things happen to our community, and talk about it. Talk about it with your friends who are valuable to you and good listeners and will be emotionally safe to you. Talk about it with coaches. Talk about it with people who have an understanding. The more we're having these conversations, I think the better off we all are, because then this disorder, which thrives on secrecy, can't thrive anymore because it's out in the open. If you're a coach or even a friend of someone and you are nervous that they have a problem, obviously be gentle. But Jodie said in the interview, it's perfectly okay to kind of point out some behaviors that you find troubling, to address to them your worries, obviously in a way that's not, again, harmful or shaming, but just what you notice and reflect back to them what you're seeing. And also don't let that conversation just be a one-time thing. You can ask their permission, absolutely, but especially if you're a coach, and I said this in the interview, you know, like when my students are injured, I will like check in on a shoulder injury and be like, hey, how's it feeling this week? How are you doing? And treat it as such. And next week I ask the same thing. How's it going? When you notice a pattern of disordered eating or you notice someone's lacking energy, and to be like, hey, I noticed this pattern and I'm going to check in with you next week as well, because just having one conversation and feel like you're doing your due diligence it's great. It's more than a lot of people are doing now, but it's not enough. And I really want to see healthy athletes, healthy artists who are thriving in this community. So support each other, talk about it, keep the conversation going. I will be keeping the conversation going with Jodie next week in part 2. So subscribe to the Artist Athlete podcast on whatever platform you are listening on right now. If you want to know more about the Artist Athlete, follow me on Instagram for all my body neutrality and training tips and inspiration. I'm at _artist_athlete. My TikTok is _artist_athlete. My website is theartistathlete.com. I'm also on Facebook, but you know, it's like Facebook, so whatever. Oh, and also, I'm on Patreon, patreon.com/theartistathlete. Actually, you know what I'm going to do, Patreons? I'm going to drop this whole thing for you early, so you can listen to the entire conversation uncut. You can listen to all the weird little things and asides that Jodie and I have. I'm going to drop that on the Patreon for you as well. So patreon.com/theartistathlete is the only place you can access that. Otherwise, I'll talk at you next week, friends, fans, and foes. The Artist Athlete podcast is supported solely by donations from people like you. Here's what some of those people have to say.
Hi, my name is Noah and I do hand balancing. Hi, my name is Woody and I do Leo. Thank you for listening to the Artist Athlete podcast.
Hi, I'm Freya. You can hear my whole story in episode 50 of the Artist Athlete podcast, but I'm here to tell you about something else that I do. I'm a qualified health and nutrition coach. I help people with sleep and body confidence, among other things. You can see everything I have to offer at wildguidance.com or follow me on Instagram at wildguidance.
Hi everyone, I'm Dominique, a ground acrobat, trapeze artist, and coach, currently bringing Circus to the extremely cold but very beautiful Northern Ontario, Canada. Circus has changed my life and I'm so grateful to everyone in this community. Find me on Instagram at domupsidedown or my website domupsidedown.com.
Aloha! My name is Beth Russell and I live on the beautiful island of Maui, Hawaii. I am an aerial artist and movement instructor specializing in chakra yoga to keep me balanced and grounded. I play with silks, trapeze, lyra, rope, acro, aerial yoga and dance, slacklining, pole, bungee, and climbing. Really anything that goes up and allows me to explore 3D space. You can find my dedicated aerial page on Instagram at Maui Aerialist. If you find yourself coming to Maui, let's play.
Hey there, friends, fans, and enemies. This is Chris Alston, Patreon of the Artist Athlete podcast, straps artist and lyra performer and acrobat out of Greenville, South Carolina. So if you're ever passing through, make sure to stop in and see me and my friends. We have a wonderful space and we'd love to see you.
Hi, my name is Erica Lee. I'm from St. Louis, Missouri, and I'm an aerialist. I teach performing arts to elementary school during the day and do pole and swing and rope by night. I really, really like the Artist Athlete podcast because it gives me a lot of circus goals to look forward to. It gives me a lot of insight on what's going on around the world in circus, and that's why I'm Patreon.
Hello all. Thank you for tuning in to the Artist Athlete podcast. I am Opal Schwartz from Minneapolis, Minnesota. If you're ever in the cities, feel free to stop by the Aviary Minneapolis. It's a great time. With that, I hope you all have a wonderful rest of your week, and goodbye.
Hey there, artists and athletes. This is Andy Smith, owner and artistic director at Saltaire Circus School in Jacksonville Beach, Florida. And I want to thank you for contributing to the Artist Athlete podcast. If you ever find yourself down in Florida, come check us out. Whether you're an artist, athlete, or someone ordinary just looking to be extraordinary, we got a place for you.